If you've been living with joint pain for more than a year, and the only thing your doctor has changed is the dosage of your painkillers, we need to talk. Because what if I told you the reason you're still hurting, even after all the pills, the creams, the cortisone shots, isn't because your arthritis is getting worse, but because the entire way we treat it might be wrong? Let me explain. Most seniors I talk to say the same thing. My doctor told me it's just old age. They gave me pills to manage it. I take them every day, but I still can't walk without pain. And that's the part that makes me pause. Not because you're wrong, but because it's the same story I hear over and over again. See, the big mistake we've made over the past few decades is thinking of arthritis as something that can only be controlled, not healed. So we build treatment plans around that assumption. What does that mean in real life? It means millions of older adults are stuck in what I call the painkiller loop. Here's how it works. You feel stiffness and soreness in your joints, usually your knees, hips, or hands. You go to your doctor. They prescribe a pill or a patch or an injection. The pain goes down, maybe for a few hours, maybe for a few days. But the joint itself, it's still damaged, still inflamed, still not healing. So a few days later, the pain comes back, sometimes worse than before. You return to the doctor, they adjust the dose or try a new brand, and the loop begins again. But here's the hard truth. Pain relief isn't the same as recovery. Taking away the ache doesn't mean your joint is getting better. In fact, many pain meds actually hide the problem. They trick your body into thinking things are okay, so you end up using that joint more, causing more wear and tear. It's like driving a car with the check engine light on, but covering it with tape so you don't see it. Just because you can't see the warning doesn't mean the engine's fine. Now, I'm not saying pain meds are evil. They have their place. If you're in agony, of course we want to give you relief, but we've built an entire system that stops at relief and never gets to repair. And that's the lie. That's the reason so many seniors stay in pain for years. Because no one ever stops to ask what's actually causing the joint to stay inflamed. What nutrients is it missing? Is the gut absorbing them properly? Are their lifestyle habits making it worse without you knowing? But don't worry, we're going to walk through those questions together. Not with scary science words, not with miracle cures, just real talk from one human to another. Because it's time to break the loop and give your joints the chance to actually heal. Let's start with the most basic question no one's asking you. Why is the joint still inflamed? Because arthritis isn't just about age. If it were, every person over 60 would be in a wheelchair, and that's clearly not the case. Some folks are hiking at 75, while others can't climb stairs at 65. The difference isn't just genetics. It's also about what's feeding us, or draining us, the joints. Inflammation is your body's way of protecting itself. When something is irritated, damaged, or under attack, the body sends in its rescue crew. White blood cells, fluids, heat. That's inflammation. It's not the enemy. It's a warning sign, a red flag. But when that inflammation never turns off, that's where the real damage happens. The joint starts to swell. The cartilage wears down. You lose flexibility. Pain becomes your daily companion. Now, here's something most people don't know. Chronic inflammation can be caused by things far away from the joint itself, like your gut. See, your gut isn't just a place where food is digested. It's also where your body absorbs the things that help your joints heal, like certain proteins, vitamins, and anti-inflammatory compounds. But for many seniors, the gut lining becomes weaker with age. It lets in things it shouldn't, and it fails to take in the good stuff. That means even if you're eating right or taking joint supplements, your body might not be using them properly. That's why you might be swallowing collagen, glucosamine, turmeric, fish oil, and still hurting. Not because those things are useless, but because they're not reaching the joint in the first place. It's like mailing a letter to fix something, but the post office never delivers it. The joint never gets the message. And here's another part. When the gut is irritated, it sends signals to your immune system to stay on guard. That means your body is always slightly inflamed, even if you don't feel it everywhere. The joints are one of the first places that get affected. So yes, arthritis pain is real. But what if the root cause isn't in the joint, but in the gut, or in your daily habits? Let me give you an example. I once worked with a patient, 72 years old, who had been taking pain meds for her knees for 6 years. We didn't change her knee exercises. We didn't give her stronger pills. We focused on her digestion. We improved what and when she ate. We added a few gentle nutrients at the right times of day, not all at once. And in 3 months, her pain was reduced by half without adding a single new painkiller. Why? Because her joints were finally getting what they needed. That's the part most treatment plans skip. They assume that throwing medicine at the pain is enough. But healing doesn't happen with a band-aid. It happens when we ask the deeper questions and fix what's underneath. In the next section, I'll show you which daily habits might be quietly keeping your joints inflamed and what to do instead. Let's talk about the little things, the daily habits that seem harmless, but may quietly be fueling your joint pain. Because when people think of arthritis, they imagine something dramatic, a fall, a twisted knee, an old injury. But in reality, it's often the silent habits, the ones done every day without a second thought, that do the most damage over time. Take sitting, for example. Many seniors sit for hours each day, not out of laziness, but simply because it's more comfortable than standing. Watching TV, reading, eating meals, resting, it adds up. But here's the problem. Joints were made to move, especially the hips and knees. When you sit too long, the fluid inside your joints, think of it like the oil in your car, doesn't circulate well. That means your cartilage doesn't get enough nutrients. Stiffness builds. Inflammation creeps in, and when you finally stand up, it hurts. So you sit back down, and just like that, you're in another loop. Another common trap? Cold breakfasts. Yes, something as simple as what you eat in the morning can affect your joints. A bowl of cereal with cold milk or just toast and jam might fill your stomach, but it doesn't warm your system. Your joints, especially when inflamed, often do better when the body is warmed up. Not just with movement, but with food. A warm breakfast like oats, scrambled eggs, or even soup can gently wake up the gut, increase circulation, and support joint fluidity. It sounds small, but for many of my patients, switching to a warm breakfast was the first step in feeling better all day. Now, let's talk about hydration. Most seniors I meet don't drink enough water, not because they forget, but because they don't feel thirsty the way they used to. But cartilage, the soft cushioning between your bones, is made mostly of water. Without enough hydration, it starts to dry out, like a sponge left in the sun. You don't need to chug bottles of water. Even sipping warm herbal tea throughout the day helps. The key is consistency. And finally, let's mention the evening habit no one talks about: late-night snacking. Eating right before bed, especially sugary or processed snacks, can trigger mild inflammation overnight. Your body should be repairing while you sleep. But if it's busy digesting a midnight cookie, your joints may not get the rest they need. These little things matter. They might not show up on an X-ray. Your doctor might not ask about them, but they can quietly chip away at your healing or support it. And the best part? You don't need to be perfect. You just need to notice, and then change one thing at a time. Because arthritis isn't just about wear and tear, it's about what you do or don't do every single day. In the next part, we'll go even deeper. Why your joints might not be healing even with all the right supplements, and what you can do to make sure they actually work. Let's say you're doing everything right. You're eating better, drinking water, moving more, and maybe even taking a joint supplement your neighbor swore by. But weeks go by and your pain is still there, maybe a little less, maybe exactly the same. At that point, many seniors tell me, I guess this is just how it's going to be. But hold on, that's not always true. In fact, the problem might not be what you're taking, but how your body is processing it. Let me explain. Imagine trying to grow a plant. You've got sunlight, you've got good seeds, but the soil, it's dry, cracked, and full of weeds. No matter how great the seed is, it won't grow in the wrong environment. Your body works the same way. You could be taking collagen, turmeric, MSM, glucosamine, all popular joint supplements. But if your digestion is off or your cells aren't absorbing nutrients well, it's like planting seeds in bad soil. One major reason for this is something no one talks about: timing. Many nutrients only get absorbed well when paired with certain foods or taken at specific times. For example, Some work better with fat, some on an empty stomach, and some need other vitamins present to activate them. So if you're taking all your pills at once in the morning, chasing them with cold coffee and toast, they might not be doing anything at all. Another issue? Overloading. More is not always better. I once had a patient who took 6 different joint supplements at the same time. Her body was so overwhelmed trying to process everything that none of it made it into her joints. It's like trying to pour 5 buckets of water into a small glass, most of it just spills. We cut her supplements in half, focused on just 2 that were right for her needs, took them at lunch with a warm meal. A few weeks later, her stiffness eased. Because sometimes it's not about more, it's about better. And then there's the overlooked factor, inflammation blockers. If your body is inflamed all the time due to stress, poor sleep, or hidden food sensitivities, then no amount of joint nutrients will fix the problem. It's like trying to repair a roof in the middle of a storm. That's why I often recommend my patients look at their whole routine, not just what they take, but how they sleep, how often they rest, and whether their body feels safe enough to heal. When your nervous system is always tense, healing slows down. So no, it's not your fault that the pills didn't work. And no, you don't have to live in pain forever. But it does take stepping back, seeing the full picture, and making small shifts that help your body absorb, repair, and rebuild. In the final part, I'll give you a simple daily plan to support healing, without fancy drugs, confusing science, or empty promises. Just a few things you can try this week and feel the difference for yourself. So here we are. After everything we've uncovered, what can you actually do starting today to give your joints a real shot at healing? You don't need to change your life overnight. You don't need a suitcase full of pills or a gym membership. You just need a little structure, a rhythm that gives your body what it's been quietly asking for all along. Let's start with the morning. Right after waking up, drink a glass of warm water, plain or with a squeeze of lemon. It helps flush your system, gets your digestion going, and starts to hydrate your joints after hours of sleep. Then, eat a warm breakfast. Oatmeal with a spoon of flaxseed. Scrambled eggs with spinach. Even a light vegetable soup if you like. The warmth calms inflammation, and the nutrients give your joints building blocks they can use. If you take supplements, space them out. Don't take everything in one go. Choose 1 or 2 key ones, maybe turmeric with breakfast, collagen with lunch, and pair them with food that helps absorption, like avocado, olive oil, or nuts. Midday, move gently. Not to burn calories and not to work out, but just to tell your joints, hey, we're still using you. A slow walk around the block, stretching your arms while watching TV, even rolling your ankles while seated. Joints love movement, just like doors that don't get rusty when they open and close regularly. In the afternoon, avoid long sitting sessions. Set a timer every 30 minutes to stand up, even for a moment. Your joints will thank you. Dinner should be light and anti-inflammatory. Think cooked vegetables, soft protein like fish or beans, and something warm. Avoid heavy fried food or sweets, especially close to bedtime. And then, rest. Truly rest. Good sleep isn't a luxury. It's medicine. That's when your body repairs. If your sleep is poor, don't ignore it. Create a bedtime routine. Dim the lights, turn off screens, and wind down with soft music or a book. Over time, these small habits add up. They send a message to your body. We're not just numbing pain anymore, we're rebuilding. Now, does this mean you'll wake up tomorrow pain-free? Probably not. But in a few weeks, you may notice your joints feel less stiff. You may stand up with less groaning. You may need fewer pills to get through the day. And that's progress. Real, quiet, powerful progress. Because healing isn't loud. It's not dramatic. It's not a headline. It's the steady return of ease, the slow fading of pain, the quiet joy of bending your knees without wincing. So don't let anyone tell you this is just old age. Don't settle for a lifetime of painkillers. You deserve more than just relief. You deserve repair. And now, you know where to begin.